Okay, this is Dr. Duke Majan with my team at Duke Spine. We have our patient here from California who's traveled to Duke Spine Institute because he's had back pain, horrible back pain for years. And he had the misfortune of going to a different spine institute in Florida. Why not? The Bonati Spine Institute, the Bonati. And he comes to us, and you can see, if you look carefully, can you see this here?
Yes, we can.
There's literally a slash mark, slash mark, slash mark, slash mark. They did, I think, 5 surgeries on him. And when he was done with all this surgery, you can see all these scars on his back. He still had horrible pain. They didn't fix anything. And the reason is they did a microdiscectomy, which doesn't work. I tell people not to get microdiscectomy, laminectomy done. It's a horrible procedure. But you could see all the scars that he came to us with. So today we're going to fix the actual source of his pain, which is the herniated disc, the annular tear. So let's get started, okay? And I don't mean to throw anybody under the bus, but you guys all got to know the truth that these other institutes that supposedly treat spine problems, they don't care if you get better or not. They just don't care. And they just honestly there to do that surgery, which is what all the surgeons do, like blind rats, little blind rats, doing surgery that doesn't work. We don't do surgery that doesn't work. Not at Duke Spine Institute. We're different. Different in a good way for the patient. All right, Sean. By the way, he's going to watch the video of his surgery later today. But he does come from California. He's here with his mom. She's accompanied him, which is really nice because people need support. And I know he's got a son. All right, we're a little bit off on orbit. You see the superior facet of 5? Show us the superior facets of 5. You guys can see them. They're like rabbit ears. There's one there and there's one there. So they're offset, which means we're off on orbit. So let's fix the orbit just a little bit more. That's the right direction. That's really good. Now we're off on WAG. You see how the pedicles aren't lined up? Let's do a little WAG correction, and the disc is not lined up either. So let's do a little WAG correction. Now it's very important if you're doing spine surgery, if you're a surgeon, other way, you need to make sure that you get your navigation. Oh, that's perfect. Oh my gosh, look at how perfect that is. Show us the perfect disc. Look at the disc. You can see straight down, it's white. And you can see the foramen. Show us the neuroforamen where the nerve lives. Show us the pedicle above. Perfect. There's the bottom of both pedicles superimposed, the top of the both pedicles superimposed. You can see the marrow signal in the pedicle. Show us the marrow, the gray stuff. Yep. So that's as perfect as it gets. That's why you have to line your fluoro up before you really start navigating. So what I can see right now is my entry point looks good, and I'm headed right for the right spot. Now, Jordan may have actually done all that, but our patient moved a little bit. So it's not Jordan's fault, Chuck. But now that I've got the correct target, like I know exactly where to go, I can navigate my needle perfectly around the facet and into the foramen. And again, this technique was first developed by Dr. Parvis Cambin. He was an orthopedic spine surgeon in Pittsburgh, and he is the pioneer who started transforaminal endoscopic surgery. That was back in the 80s and 90s. All right, I can feel the herniation right here. Look at that. Go, Cine. I'm going to show you a video of me bumping up and down. You guys see the needle bumping up and down? That's actually, it's good. That's actually the herniation I'm bumping on right there. So it's way out here where the tip of the needle is. Okay, so I'm going to go into the disc. Shot. I'm hitting the superior end plate. There we go. All right, so that's one down. Now I'm going to give a little more num-num to make my patient comfortable. This is numbing medicine under the skin because we're going to make our incision. The incision for the surgery will be 1/4 inch, 7 millimeters, folks. And by the way, that needle is sunk almost to the hilt. So, all right, so there's the Duke spine incision. You guys see that? One incision, 7 millimeters, way over here. And you can see all the other cuts that he's got when Dr. Kruger operated on him. Anybody know Freddy Krueger from the 80s? Those horror movies, that evil man with that burned children in an oven in a basement, and he had these long scissor-like fingers. Well, Freddy Krueger still haunting people today. I heard that the Bonatti Spine Institute was closed down by the government, and I don't know if they've reopened yet, but maybe better that they don't. Anyway, I'm sure there's going to be some hate mail from Bonatti to me over mentioning their company. He always has his lawyer sending me nasty letters. Sean? You'd think he'd have better things to do with his time. All right, almost done. Yep, I can feel the herniation there, and yep, perfect. We're ready for our patient to interact. So far we've lost about 2 drops of blood. You guys see the whole incision there is just 1/4 inch. So the first question is, how long has he had back pain?
How long have you had back pain, sir? My friend, how long? How long? How many years? I can hear you. Speak louder, please. How many years?
How many years have you had back pain? Do we know?
So he said he had back pain starting in 2022, just before this whole.
Oh, well, yeah, that's usually when it gets bad.
Yeah.
But all right, so he's still waking up. So we'll wait another minute. But when I saw him, obviously I was aghast at all these scars that he has from his prior surgeries. And he was crying to me actually in the office, because he's been through so much, and he's so frustrated about the fact that he's had all these surgeries and he's no better as a result. Now, most surgeons would not want to operate on a patient like this. I mean, my colleagues probably think I'm crazy, but the truth is this man is suffering with pain. He's taking care of a family member who needs his help, and he's just debilitated with pain. His quality of life is horrible, and he knows it's not going to get any better. So he came to me out of desperation, said, please fix me. I looked at him and I said, I could fix this. You know, he's got 2 bad discs, they're fixable. I know where the pain's coming from. It's 3, 4, 4, 5, easy. But most doctors would just turn him away because they look at a patient who's had multiple back surgeries and they say, this guy's not fixable. You know, he's just going to have surgery, he's going to keep complaining. But that's because they're doing the wrong surgery. They're not doing the right surgery. So he's got a disc here, and this is the L4-5. Yeah, we're just letting you wake up, my friend. And then he's got the L3-4. He's got 2 bad discs. They both have tears on the right side with herniations on the right. And that's what we're actually in those 2 discs right now. You can see it on the x-ray. So we're going to test him while he's almost completely awake. And get him another minute. All right? Any questions from the audience so far?
No current questions, but we do have a comment from Nick on Facebook. And they said, good afternoon to my favorite doctor and his team. I am crying too because I don't have the money for this surgery, but I believe someday, somehow, I will make it.
I believe you will too, Nick. I really do. I believe one day somebody with a lot of money like Bill Gates, his conscience will finally get to him. I was just looking that Microsoft is now valued just below Apple, with the second highest valuation at $2.2 trillion. You got to think, you know, somebody like Bill Gates who has hundreds of billions of dollars, why would they not want to donate money to help people get out of pain, you know? They've got these medical foundation that does absolutely nothing as far as I'm concerned, and nothing to help the public. So we should take away the tax exempt status. But eventually I think somebody like Elon Musk will make a donation and it'll help people out that need help. I would love to be able to do everything for free, but we have a lot of expenses here. All right, so back pain for 6 years?
Yeah, 7 years.
7 years. 7 years. Okay, 7 years. And is he awake totally?
Waking up, okay?
All right, let's get started. So we're going to verify these discs are the cause. I feel really good about it. you know, these two discs are the cause of his pain because they're right where his pain is on exam. And on his physical exam, he points right to these two discs. And I'm just sorry that he's been through the butchery that he's been through elsewhere. All right. Is he reliable?
How are you, my friend? You okay?
Dr. Duke here. We're just going to get you to sleep in a minute, but I need your help, okay?
Good, okay?
I know you've watched a lot of my surgeries from California, and you probably know what comes next. All right. Any back pain right now? Don't move around. You got to lay still.
Do you have any back pain right now? He said no.
Good.
No back pain.
How bad is that on a scale of 1 to 10? You could hear him say, ow, ow. Show us the tear.
He just said a 10.
A 10. All right. Is that where you typically get your back pain? You knew that was coming, didn't you? Can you guys see the tear? Show us the tear, Henry, on the x-ray. Guys, it's a perfect tear. Look at that tear. I mean, just circle the dye, the black dye. You guys see the black dye? That dye is sitting, no. The dye in the tear, the posterior tear. It's called the posterior annular tear. Put your arrow below the tear, right there, a little further to the right. Henry, take that picture, capture it for me. I would like to include it in one of my papers I'm going to do. All right, will you save that picture right there? Take a couple of screenshots and send that to me, please. And keep it in our research folder. All right?
Copy
It's
that.
a beautiful tear. Okay, so 10 out of 10 at L4-5. That's what he had. And it was concordant. Concordant means that's my typical pain I get every day. So far, we've lost 5 drops of blood. Is the pain gone?
Do you have any pain now?
No pain. Perfect. How bad is that on a scale of 1 to 10? 10. All right, perfect. There's your second tear. So we're going to go put you to sleep now. When you wake up, that pain will be gone. The rest of your life, gone permanently.
I'm just going to readjust something before he goes to sleep.
Yeah, you do that. 10 over 10, concordant at L3-4. Folks, we just confirmed that he has his back pain he's been suffering with for 7 years and undergoing the Freddy Krueger surgeries elsewhere at, other places. And all that surgery he's traveled to and had done, none of it fixed his back pain, just made him worse. And now he's going to have relief for the first time in his life. This is seriously like National Geographic kind of stuff. Unfortunately, National Geographic doesn't care. All right. I want you to count from 1 to 100 out loud, okay? I want you to count in Spanish. Is Spanish your native tongue? Huh? Yes? All right, count for us in Spanish. If you make it to 100, I don't pay the anesthesiologist today. Sean? So that's always a test of whether or not they like the anesthesiologist, because if they start speeding up, counting faster, that means they don't like the anesthesiologist. He's going slower. He likes you, Dr. Berndes. He likes you. That's good. Do you need any help up there?
Yeah.
You do?
Yep.
You want a nurse?
Yes, I do.
Can we get our nurse up there, please? You want me to hold off or keep going? All right, I'm going to give a little bit of numbing medicine. Any questions from the audience?
No current questions.
All right, while we're getting the moving here, I'd like you to start our video on why do herniated discs actually cause back pain? What's the mechanism?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Okay, welcome back. We're now placing the dilator over the guide wire into the annular tear. And I'm just giving my anesthesiologist a minute to get everything situated up there. Actually, patient's asleep enough, so we're good. All right, we'll just wait here. So people ask me, Dr. Duke, doesn't that tube going in the disc, doesn't it cause damage to the disc? The answer is no, because the tube is already going through an already damaged part of the disc. That's where the herniation is. It actually helps because it shoves the herniation back into the disc. Can I proceed or wait? Yep. All right, just give it a minute. All right, let's show our audience how does the Duke laser disc repair actually help patients by getting rid of the inflammation, the source of the inflammation that's happening in the back of the disc where the tear is.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back, and we've just shown you on our animation video how is it that the annular tear with all that pain and inflammation coming from it gets treated with the Duke laser disc repair. And it's simple. It's called annular debridement, and it was created by Duke Spine Institute. We're the first ones to do it, and we're the first ones to publish it. A laser annular debridement done by a laser. Okay. Now, the annulus is really, it's like a ligament that we find throughout the body, whether it's your ankle, your shoulder, your hip. You've got ligaments. They hold bones together, and ligaments can become injured. They get torn. Very common problem. We've all had a sprained ligament in our life. I've had many sprained ligaments in my foot, playing basketball, soccer over the years. And ligaments, you know, they can heal as long as you give them the right environment to heal. However, when you have this blue stuff from the center of the disc sticking into the ligament, where the tear is, the blue stuff gets into that tear and it keeps the tear from healing. It just doesn't allow it to heal. It creates inflammation. It basically makes inflammation happen. And the reason it does that is your body, your inflammatory system, sees the blue stuff as being a foreign invader, being something bad there. It recognizes it as bad, not part of the human body, not part of yourself. Okay, when we talk about recognition of self, we usually talk about the immune system and immunological recognition using using little protein markers, okay, and using things like major histocompatibility complex, which is a very interesting protein that's found on the surface of all of our cells. It basically presents self-antigens to the immune system, so the immune system, as it floats around, recognizes our cells as being self because of the MHC complex, and then it sees bacteria as foreign because bacteria don't have the self-antigens that the body is normally used to seeing with the immune system. But inflammation is not an immunological response, it's the opposite, it's an inflammatory response. So if you think about your body as having two old defense systems, all right? Well, you got your skin and things like that that act as walls or barriers, but then you've got these active systems that literally patrol your body, everything from your skin in, and they're looking for things that aren't supposed to be in your body so they can attack them. You know, they're like security guards at a factory. They're probing and they're trolling around the perimeter looking for people that are, you know, breaking into the factory. So either they're inside the factory, they shouldn't be after hours, or they're within the fence, you know, the property. And when they see those individuals that have, you know, come in to that area, they shouldn't be there, they attack, right? That's what they do. So it's a defense system, two defense systems. One of them is the inflammatory, the other is the immune. And when it comes to back pain and neck pain, it's the inflammatory system that is the cause of the pain, not the immune. Okay, so the inflammatory system recognizes, see the tear right there? The inflammatory system sees that blue stuff and says, hey, that shouldn't be there. And it starts attacking it. And that's where all the back pain comes from. So what I'm doing is I'm just helping this patient's body get rid of the blue stuff, because he'll probably get rid of the blue stuff in about 365 years. But he won't live 365 years. And then his whole life will be miserable because he's going to have pain his whole life. Because of that blue stuff, he just can't clear it. He can't get rid of it. Anybody watch The Walking Dead? You remember Morgan? What does he always say? Clear. Remember? That was his thing, clear. He had to clear the area of the bad guys, the zombies. That's what he did. He cleared. Okay? That was his big thing, clear. What clear means is you go in and you get rid of the threat, the bad thing. Well, your inflammatory system inside your disc sees the blue stuff as a threat, as a foreign invader, someone like a zombie that shouldn't be there. So it has to get rid of it. Morgan would kill it with a stick or with a machine gun, but ultimately the purpose is to get rid of the assailant, or whatever you want to call it, the negative entity. Any questions?
No current questions, but we do have another comment from Nick once more on Facebook. And they said, I feel so sorry for all those people that chose the wrong doctor and the wrong surgery. Congratulations, doctor, for your amazing work.
Hey, Nick, thank you so much. I really appreciate it. You know, I used to do those surgeries myself. Of course, I did them to the best of my ability. I did them very well. But, you know, in the end, a laminectomy, you're taking bone, ligament, tendons, muscle out of the patient's body, normal stuff, just to get down to where the disc herniation is. And then you got to pull on the nerve root just to get to see the herniation. So those surgeries are highly invasive, old style, but you know, when you're learning how to do them at your university neurosurgery training program, your attendings don't say to you, hey, we're going to teach you a really shitty way to do spine surgery. They tell you this is the way to do it, this is the right way. And that's because I honestly think many of them believe it's the right way. That's just what they know to do. They don't know any better. So, you know, unfortunately, our training centers, our academic training institutions are training spine surgeons improperly. Some of it's definitely motivated by greed and corruption by the spino-industrial complex, and a lot of it's just born out of ignorance about how the advances in spine surgery are. He's moving a little bit. You can see him Valsalva. You guys see the Valsalva? Where right where the tip is now, there was a piece of herniation that came out from the tear. He actually helped me get rid of that through Valsalva. There he goes, Valsalva again. You guys see that? So the Valsalva is helping me actually get rid of the pieces of herniation. There's the tear right there, tear right there. He doesn't like it because, of course, we're right in that painful area of his disc, but I don't mind him being a little light if you need him light for respiratory reasons. Whatever you're comfortable with, Dr. Berndes, just keep him safe. That's the most important thing. He'll forget the pain of the surgery, but safety is of utmost importance.
We have a question.
Sure.
This comes from Nick once more on Facebook.
This disc, about 1 minute.
They asked, how was the idea came and you decide to insert the laser from the side, and you created a new method that's not that does not injure muscles and
30
bones
seconds.
like the other type of surgeries?
Yeah, great question, Nick. So the truth is, the part that you watch me do where I put the tube in, that's not what I created. That was done before me. I learned that from one of the couple of the endoscopic spine surgeons that were doing this before me. It's the part with the laser that I'm doing right now, the debridement. This was my creation. And how did I do it? Well, I started to use, I'm all done. I started to use the laser to help me remove the herniation. And as I'm doing it with the laser like that, I with the debridement, I had patients wake up. I'd say, how's your leg pain? They go, oh, it's gone. And my back pain's gone. I'd be like, what? How's your back pain gone? I didn't do anything to get rid of your back pain. But then again, I did. I just didn't realize what I was doing, which was cleaning that tear. So I went back after like 10, 15 patients where I got rid of their pain in their back or neck. And I said, what am I doing here? And I realized what I was doing different from all my colleagues was I was using a laser, number one. Number two, I was doing an annular debridement. That's really what I was doing. You know, I was debriding the annulus. So when I put 2 and 2 together, that's when I realized that to get rid of the back pain, you just had to do an annular debridement with the laser. I've thought about other ways to do it, like radio frequency, things like that, but they don't work as well. The laser is the tool. It's like nothing else comes close. It's like the difference between playing soccer with a round soccer ball versus playing soccer with a football, right? I mean, the round ball is the way to go. It's like the perfect shape for soccer, right? Well, the laser is the perfect tool for cleaning a tear. And I just happened to be the one to discover it, you know? And that's it. I just got lucky, I guess. I think it was more luck than anything else, to be honest. And also the fact that I was willing to try a new technology, which I've always been willing to try new technologies, because I always want to do it better. Like, is there a way to do it better? Like better outcome for the patient, safer for the patient, like better pain relief, faster recovery, less bleeding, less scar tissue, less trauma to the body. I mean, I'm always looking for better, better, better in all those categories. And so I've always looked for ways to do things better. I've just never been satisfied with the status quo, because there's so much that needs to be done because the status quo sucks so bad. Look at all these people having spine surgeries and they do worse, or they don't get any better, and they go through all that pain and suffering of the surgery. There has to be a better way, right? So it just drove me to search for a better way. I guess I got lucky finding it. Shot? All right, so now we're going to go to 3-4. Both of these discs, by the way, were 10 out of 10 pain. So we know, huh? I'll do some numbing, sure. You want me to numb you or him? All right, let's put some num-num. All right, great questions, by the way. Keep them asking them. I'm putting a little numbing medicine as I'm advancing this dilator. You just can't put numbing medicine by the nerve root, otherwise the patient's leg will fall asleep and they'll wonder, what the hell did you do when you're in there? And you got to sit there and explain. By the way, you can see the herniation there. You see it? Yeah, right there. All right, Sean. I'm actually bouncing on it right now. I can literally feel the herniation with my tip of my tool, my dilator. So I'm gonna, now this is the brilliance of Dr. Anthony Young, one of my mentors, okay? He's a generation ahead of me. I'm 53, he's 83. He taught me a lot about lumbar endoscopic surgery. And he taught me this technique right here where you drive the dilator inside the disc, okay? And the reason for doing this is I'm literally shoving the herniation back into the disc. And then I'm going to go get it out from inside the disc. Okay, take the guide wire out. So once you get the dilator inside, you literally push the herniation, main part of the herniation, back into the disc, and then we go take it out endoscopically. So that part, these tubes and stuff were all developed by Dr. Hellinger, okay, Stefan Hellinger out of Germany. He was also a pioneer. He was a contemporary of Dr. Young. Dr. Young and Dr. Hellinger are good friends. They're both my mentors. And they both taught me a lot about endoscopic technique. So these tubes and stuff are all FDA approved. I didn't develop and design them. They were shown to me. Again, what I did special was the annular debridement. That was my little contribution. But it makes all the difference in the world with two things. Number one, getting rid of the back pain, and number two, letting the disc heal naturally so another herniation doesn't happen. So there's two reasons for the debridement. Those are the two reasons. Once the annulus heals, you won't get another herniation. All right. Here we go. Second and last disc. Our next patient, by the way, this patient's from California. The last patient we broadcast earlier today was from Missouri, right? Huh? Yeah. And then the second patient we didn't broadcast, she was from North Carolina. She's already gone. Actually, both patients are already gone. They already went home. These are outpatient surgeries, folks. We don't do them in the hospital. There's no reason to do these in a hospital unless you need the hospital to buy you the equipment, which is a good reason. A lot of doctors won't spend their own money buying advanced equipment for their patients. I didn't have a choice. It was either do it with my own money or I wasn't going to do it at all. So I chose to use my own credit and buy all the equipment, spent millions and millions of dollars. And here I am doing these surgeries without the support of a hospital system or really anybody else but my patients. Just my patients. It's the way it should be, doctor-patient relationship. Honestly, insurance these days is useless. They don't pay for anything. They may get your bill lower for you, but that's about all they really do. People ought to just pay for catastrophic insurance, like if they get real sick and they need it, an accident or something, but they should just not have to pay premiums for things that the insurance company won't cover. All right, questions?
This next question comes from Benjamin on YouTube.
Hey, Ben. Benjamin.
They asked, are you able to treat a disc bulge, and do you treat stenosis? You should be receiving my CD this week. Thank you.
Yes, Benjamin. Thanks for watching and thanks for commenting. So we do treat stenosis. What is stenosis? Stenosis is narrowing. It's a Greek term, Latin Greek term, and it means to narrow. And there's different kinds of stenosis in the human body. You have artery stenosis, like coronary artery stenosis, or which causes heart attacks, carotid artery stenosis, which causes strokes, and then you got spinal stenosis, which causes pinched nerves. And this surgery is the best surgery in the world for stenosis because it literally goes into the disc, in the back corner of the disc. That's where the stenosis is causing the most symptoms. It's the most important place to treat stenosis, is the back corner of the disc. So this is the perfect stenosis treating surgery. Cervical, lumbar, thoracic. And then the second question was, remind me, Henry.
There wasn't no second question. There was
Well,
just
the same question, but the second part.
you should be receiving my CD this week.
No,
Thank
but
you.
read the question again for me.
Are you able to treat a disc bulge, and do you
Yes.
treat stenosis?
Yeah, sorry. So yes, a disc bulge is the perfect problem for this surgery because it's bulging in what's called the lateral recess and the neuroforamen. And that's where the stenosis occurs that causes pinched nerves. So this is the perfect surgery for that problem. Okay, look at that. Pretty cool. See the inflammatory tissue? The pink stuff right there? It's kind of washed out because, well, we have a little bit of overexposure on the camera light, but not bad enough to do anything about. But that was inflammatory tissue we just saw. This right here, you see this orange stuff or gold color? I don't know what you see on your monitor, but that's calcium. That's calcium, okay? And the reason there's calcium is because that's scar tissue, the white stuff right there. So there's calcium and scar tissue within the tear. That means that the tear's been around for a while. That means there's been a lot of inflammation going on there. Anytime you see calcium and scar tissue, see there's more calcium right there, down there where the laser is. There's some nice blue nucleus, degenerated, acidic. So this is a disc bulge, by the way. This patient has disc herniation, disc bulge. Disc bulges are disc herniations. They're just smaller herniations, that's all. It's the same mechanism of injury. It's the same structural abnormality, just what people call herniations, which disc bulges are herniations. Most people think of a herniation being a little bit bigger. So a disc bulge is just a small herniation. It's the same thing. It's no different. From the purpose of causing symptoms in a patient, a disc bulge and a herniation are identical. There's no difference whatsoever. And therefore the treatment should not be different either. They're really the same. Great questions. Look forward to reviewing your MRI with you. See the inflammation right there, guys? Look at that. That's perfect. Can you turn the light down just a little bit? I don't think we need this for our study. But there we go. There we go. Now you can see it. Just one more notch. You guys see how pink it is? Henry?
Yes, we do.
Now say goodbye. Say hello. There's some more. Say hello to my little friend. This is the perfect tool for getting rid of back pain. The laser is. You can't get rid of that pink stuff with a grabber. It won't go away. It's slippery like a fish. It doesn't want to leave. So the laser is the best tool in the world. It's the most efficient, safest. Lasers are going to be everywhere someday in every back surgeon's operating room, and they're all going to be doing this exact surgery someday. All right, I guarantee you. I'm sorry, we have 3 minutes. All right. 85% of back pain, neck pain is caused by a disc injury like this. And the Duke laser disc repair is literally the best treatment in the world for that. There is nothing that comes close. No artificial discs, no fusions, no laminectomy, no discectomy. Avoid all those surgeries, folks. They're bad. Highly invasive and unnecessary. This is the safest, least invasive, fastest return to work. No scar tissue, no bleeding. I think we've lost like 5 drops of blood. And we're just about done. And this patient will literally go home an hour after we're done. Of course, he's going to go to a hotel because he's from California. He's going to fly out to California tomorrow night. One day after surgery, most of our patients fly in and out of Orlando International Airport, and they go home.
We have a question.
Yes, of course.
This comes from Nick once more on Facebook.
Hi, Nick.
They asked,
Uh-huh.
is this a special type of laser? What's the differences between lasers?
Yeah, great question, Nick. Thanks for asking. This is called a holmium YAG laser, HOLMIUM. YAG stands for yttrium, argon, and garnet. And basically a holmium YAG laser is, it's an Israeli laser. It's made in Israel. But a holmium YAG laser emits a certain kind of wavelength of light, and it creates a special kind of sonic pulse underwater, which all the stuff you're seeing down there is liquid. So it creates a cavitational pulse or wave that helps dislodge the fragment. So this is a very special laser. There are other types of laser like CO2 lasers, potassium lasers. I would not use any of them. They are the wrong kind of laser to use. This laser is also safe to use in liquid. You see the liquid down there, all that water? That's cooling the laser, cooling the tissues. It's very cold irrigation. We refrigerate the irrigation. It comes out of almost a freezer. Honestly, if you drink beer, this is the perfect temperature for beer if you like cold beer. It's super cold. 1 minute. Great questions, and we're going to be done in 1 minute, and then I'll come and answer your questions. So feel free to type your questions up. I'm going to answer them for you. And I'm very happy for this patient. He traveled all the way from California, suffering with back pain for over 6 years, and has, you know, a family to care for, feels horrible, totally. Back pain is dehumanizing, folks. If you have back pain, you understand what I'm saying. It takes away your dignity. It takes away your ability to contribute to your family, to your friends. You become a recluse. And people don't understand people with back pain. They treat you like you're a leper, not because they're afraid to catch your disease, but because they think you're just full of shit and that you don't really have a problem, but you do. And it's debilitating, and that's what Duke Spine does. Our focus, our specialty is curing back and neck pain. So we're here for you. Don't suffer alone. Don't give up hope. Definitely don't commit suicide. It's not worth it. Okay? Too many people are offing themselves because they live in chronic pain. We need this to stop. The solution is not drugs. The solution is not marijuana. The solution is not open back surgery. The solution is not fusion. This is the solution right here. This is the future of spine surgery here today at Duke Spine Institute. All right, well, I hope you've enjoyed the surgery. There's the nerve root right up in there, and we're done. Okay? I'm very happy with the results. You're looking from the outside of the disc to where the herniation was. You can see the epidural fat, and the nerve root is right up there, but we can't see it because it's buried in fat. And that would be the L3 nerve root on the right side. All right, hope you enjoyed it. We've got one more surgery today. Our last surgery is going to be a single level lumbar L4-5, one level. Our patient comes from, I thought it was Michigan, but it's Indiana. She's from Indiana. And she traveled to Florida to have her back fixed, like many people do. And she's an interesting story. I think we're doing thoracic as well, right? Thoracic DPR. So we're going to be doing a Duke plasma rhizotomy thoracic.
You're all done, my friend.
Don't move, we're almost done. And she's going to have a single level lumbar DLDR. She's getting her thoracic and lumbar fixed with two totally different surgeries for two different problems. One facet, joint pain, and the other one disc pain. All right, so all done. I'm going to show you guys.
Good news. My friend, you're all done.
For those of you who came in late, our patient has already gone and had, I think, about 5 surgeries on his back, desperate to get relief of his back pain. And like I said, they carved him up. You can't really see it anymore, but go back and watch the beginning. You can see all the scars on his back. Actually, here. Can you see those?
Yes, we can.
Thank you, Luis. All right. Pretty horrible, huh? You guys see that?
Yes, we do.
Pretty obvious, huh? Well, here's ours. Tiny, solitary, and that's the solution. Thanks, Louise. Great job. Everybody, good work today. Well, one more to go and we'll be done. Hey, folks, type up your questions, and I'll be happy to answer them for you. And if you know somebody suffering with neck pain, back pain, thoracic pain, we'll do a free MRI review, no charged, and figure out what's wrong and how to fix them. And then if they want to get fixed, they can get fixed. All right? Let's cut to one of our patients who had this done, and we'll share their story with you. This is Dr. Aru Duke-Majan, CEO and founder of the Duke Spine Institute. I'm here with one of my patients, and you've traveled from where to the Duke Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Duke laser disc repair done and the Duke plasma rhizotomy?
I had those done yesterday in the afternoon. I am sitting straighter than I have. I'm standing straighter. I'm walking normal. It's like, wow, new me.
Look at that smile right there. I hadn't seen that until just now. So
well, it wasn't there yesterday.
Yeah, it wasn't there before surgery. And how long have you been not smiling because you've been in pain? I mean, really bad pain. How long has the really bad pain been there?
Well, the really bad pain has probably been over the last 5 years. It's something that was really tough to maintain a positive attitude and try to keep a smile on my face and keep Jeff's hopes up. I tend to be a positive person, but there were times when it does drag you down.
Of course, yeah. It's hard living with chronic pain, and especially with loved ones, they have a hard time, relating. Of course, they want to be supportive, and your husband is a very supportive man, obviously. And he's a pleasure to meet. I know he's an author as well.
Yes.
And so what are you going to do now that you've had the surgery? And you could see actually the Duke laser disc repair procedure she had done yesterday. You can see right here, we went into the discs that were damaged. You had 2 annular tears. We tested your discs during the surgery, and indeed they were causing your pain. So we verified that with our discogram. And then I went ahead and used the laser to clean up the tears that were causing your pain and get rid of that source of pain for you. And here you are, you're doing fantastic. How much of your back pain from before surgery do you still have?
Oh, virtually nothing.
It's gone.
It's gone.
Cured.
My lower back, I have not been without pain in my lower back until your surgery. It's constant, it's always there. I've never been without it. I'm without it now.
So are you going to go back to gardening?
You bet I am.
All right, very good. And what other things would you like to do now that you have a new back that doesn't hurt you anymore?
The biggest thing I want to do? I want to go fly a kite.
Good for you. Let's go fly a kite then.
That's right.
Well, congratulations on having faith
Oh,
and being
thank
brave
you.
and getting it done.
Oh, not a problem.
Is there anything else you want to say to your fans out there?
I highly recommend Dr. Duke's Spine Institute, Dr. Duke personally, to help you fix your back.
Thank you. Appreciate that. All right. Safe travels.
Phew, that wasn't too bad, was it?
It was wonderful. And good morning, I'm Dr. Duke Majan. I'm here with one of my lovely patients from Canada who's visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L5-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada, who then said, yeah, I'll have you see the specialist in 3.5 years. Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years. And even then, you don't know what you're going to be offered. But she found the Duke Spine Institute and learned about the Duke laser disc repair endoscopic surgery. And you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be able to stand up straight and go for a walk. Because I'm an active person as is. I ride horses for a living, so having to be locked up in my room for the past while has not been good. So this has felt amazing, amazing.
So you're happy with the results?
Very. I feel very hopeful also to be able to do what I want to for the rest of my life.
Yeah, after we let the disc heal, right?
Yes, full year of nothing, and then we can.
Yeah, I wouldn't say nothing, but you know, horseback riding, it's one of those things where I love horses and I love riding horses. I'm not very good at it, but I'm one of those people you see bouncing up and down, up in the saddle. So I know that it can be rough on your back, and I just want to make sure you give your back a full year to heal. So you can see in your surgery right here, we actually tested your L5-S1 disc with a discogram, which is a test done to verify that that disc is indeed causing your back pain. And when we tested it, you said, and we asked you how bad it was, you said 10 out of 10 pain. And I said, is that your typical pain you get every day? And you said, yes, it is. So we verified the source of your pain was the L5-S1, and you can see the laser was used to clean the tear endoscopically. Your incision was only 1/4 inch, and there's no need for fusion or metal or artificial discs. This surgery replaces fusion and artificial discs. What are you going to do now that you're feeling better?
Well, it's, again, don't worry, I will take it easy, I promise. But no, I'm going to be, after this, this year, I hope to be the strongest I've ever been, and I have very high hopes and whatnot. My dream is to make actually the Canadian Olympic team for my sport, and that's end goal, and I feel like it's a possibility now.
Absolutely.
To do it.
You can.
Yeah.
We're rooting for you.
Mm-hmm.
And I know you have an incredibly supportive husband who's been by your side the whole time. He's a delightful young man, and I've had time to talk to him as well. So you're lucky you have support from your family to help you get through this.
Yeah.
Anything you want to say to your fans out there?
Oh, geez, I don't even know where to start other than just this place really can offer you really what either you deserve or what you need going forward to be able to live a happy and good life. And it's amazing to me that literally it was yesterday I woke up from it and I went for a short walk like immediately, and I felt amazing. So it's it's very hopeful, and if you are suffering from any of it, don't wait, especially for the Canadian system. Come and do this. It's worth it. It's really worth it.
Awesome. And I'm going to be, and my whole team is going to be watching the equestrian sports in the Olympics, looking to see for you to be there.
Yes.
All right.
Awesome.
And
Amazing.
of course, supporting you.
Thank you. Yeah.
All right. Congratulations.
Thank you.
All right. Take care. Well, I sure hope you enjoyed that patient's testimonial as much as I have. She was from Canada. She wants to be an Olympic horse rider, and I think she's going to make it, folks. She came to Duke Spine Institute with a herniated disc in her lower back, and she had really bad back pain going into her leg. A lot of patients wait. They get back pain first from a herniated disc, and they kind of wait, and they usually don't seek really surgical treatment until they get leg pain. And the reason for this is because their doctors have told them, hey, if you don't have any leg symptoms, we're not operating. What a shame, though, huh? I mean, this patient right here that we just did surgery on, actually, he's had back pain for 7 years, but the doctors, again, blew him off, right? Go to pain management, take these pills, do some marijuana, whatever. Do something, go to therapy. None of that stuff works when you have pain from a herniated disc. And he waited and waited until finally he had leg pain, right? But he blew 7 years of his life. And, you know, it breaks my heart to think about what these people go through every single day for 7 years. Think about that. Imagine not being able to be a human being for 7 years. Why? Because some doctor told you, society told you, some book told you, some internet article, some person giving advice when they shouldn't told you that there was nothing that could be done. Just grin and bear it. Take some pills, you know, do some therapy, take it easy, don't do anything strenuous. And people are being robbed of their quality of life. And that's why I do what I do. I am a avid champion for patients to get their life back and take control of their life away from the pain, away from the suffering, away from the misery. That's what we do at Duke Spine. We cure your pain so you can have a normal life. So, I know we don't have any questions, so I'll talk for a minute about the disc. If you look at a disc, you've got this wall around the disc, and then with a herniation, there's going to be a tear in the wall, and the jelly in the center gets pushed up through the tear, and it kind of pushes out, right? So you got the part sticking out, you got the part actually wedged into the tear. Well, it's the part sticking out that pinches the nerve, and it's the part wedged in the tear that causes the bulge or the back pain, basically, or neck pain if it's in the neck. With the laser surgery we're doing, we fix both. And the way we do that is I actually enter through into the disc right in the bad area. So people say to me, hey, aren't you going to hurt the disc with your tube? No, I'm going in where the disc is already hurt. And the area that I'm going in with, the size of the tube, 7 millimeters, it's tiny. It's 1/4 inch. So the tear is always bigger than 7 millimeters. It's around 1.5 centimeters. So it's always twice as big as the tube, at least. So we're not doing any damage to the disc. Anyway, thought I'd share that with you. Any questions or comments?
That is it.
I guess you all know everything about the spine. So have a great day. We've got one more surgery. Our last patient is coming to us from Indiana. And she is an interesting one. You know, when she showed up here, we had done one of the MRI reviews for her, and she had a herniation at T4-5, T, thoracic 4-5. But when I actually examined her in clinic yesterday, I saw the pain was not coming from T4-5, it was further down. And I thought, you know, I told her, I said, listen, you're here for T4-5 surgery on the disc, but if I do that surgery, you're not going to be any better. Your pain is down around T8, T9. So we got a new MRI, and guess what? No herniation. So I started scratching my noggin, and I said, well, if it's not a herniation causing the thoracic pain, the second most likely cause is the facet joint. So guess what we did? We took her yesterday, and we did a facet block. See the facet joint right there? There's the disc. There's the facet. We numbed up the T7-8, 8-9 facets. Guess what? Pain went away 100%. She was crying. She was so happy. Of course, it wore off because it was a diagnostic block. We call it a medial branch block. Very common. But at least we know the pain is coming from the facets in her thoracic, not her disc. So now, today, she's going to have the Duke plasma rhizotomy, which is the newest, most advanced treatment in the world for facet joint pain. So if it's not your disc hurting you, it's got to be your facet. Facets account for 10% of chronic back pain. Disc accounts for 85%. So together they account for 95% of chronic back pain. So if you've got pain in your back and it lasts more than 2 weeks, it keeps going on for months and months, even years, it's 85% chance it's your disc or discs, plural, 10% chance it's the facet joints. Between the two of them, 95%. And we have permanent treatments for both. The other common cause of back pain is the sacroiliac joint. What is the sacroiliac joint? Well, that's where your spine comes down and connects from your sacrum to your iliac wing, iliac bone. You can see it better from the front. You see this right here? That's a joint on the right, and there's one on the left. Well, guess what? We've got a treatment for this too, the Duke plasma rhizotomy. We can go in and burn these pain nerves. By doing that, it takes the SI joint pain away. And there you go. That's about 98% of chronic back pain comes from either the disc, the facet, or the SI joint, and Duke Spine Institute cures all three with one treatment. So this lady is going to have a rhizotomy done called the Duke plasma rhizotomy, T7889, 2 facets, 3 nerves, and we're going to do her lumbar spine because she's got a bad disc at L4-5. She's having back pain, says it drives her crazy. So we switched her from a DLDR thoracic to a DLDR lumbar, and we're going to do the rhizotomy. Any questions?
Yeah, we have a few questions. This first one comes from Darren on YouTube, asking, would you see if you needed this procedure?
Would I what?
I understand if you don't want to answer this, but would you see if you needed this procedure? Well, that doesn't make sense.
Darren, I appreciate all your comments today and in the past. Would you see if you needed this procedure? I think there may be an auto correction going on here, but I'm not really sure
Until then, next question.
what you mean.
Well,
Yeah, sorry, Darren. It's not that we're not trying to be helpful. We honestly don't know what you're asking us. Try to rephrase it.
Next question comes from Talon on YouTube. They ask, what is the difference between a percutaneous laser surgery and a DLDR?
What's the difference between a percutaneous laser surgery and a DLDR? Great question. Percutaneous surgeries are done through needles. That's the definition of percutaneous, done with a needle. So we used the needle in the beginning, but then we put a guide wire, made an incision, and then we did it endoscopically with a tubular tractor. So everything after the needle part, that's when it becomes not percutaneous. There was percutaneous laser disc decompression, percutaneous intradiscal electrothermoplasty. These were pain management procedures that were popular in the 80s, and they were done by placing a needle, like I did, into the disc, and then they would put either a radio frequency probe or they would put the laser down the needle and they would blast it a few times, zap, 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 5 seconds in each one, and they were done. And they were doing the laser blasting not in the annulus, but they were doing it in the center of the disc, so the nucleus. So basically, huge difference, not even close. That would be like saying, what's the difference between a Gatling gun and a BB gun? A BB gun isn't going to stop anybody or anything in the act of war. A Gatling gun is really what you want to have by your side.
Coming back to Darren's question, he replied back, who would you see?
Who would I see?
Yeah, who would you see if you needed this procedure? I looked at it wrong, my eyes just been staring at screens like that.
Poor Henry. So, Darren, I apologize. We understand your question now. Who would I go to if I needed this procedure? I would have Dr. Patel do it, my partner. He's been with me for, well, since 2006. So, what is that? 17 years now? Dr. Patel is an incredibly gifted doctor. He is an interventional pain management doctor. He has 5 board certifications. He's got more board certifications than I know of anybody to have. And he's very compassionate as a doctor. He wants his patients to get better and be out of pain, just like me. He's literally built Duke Spine with me. I have every respect and trust for him, and he does for me. I've taken care of him on several occasions, let's just say. And he would be the person I trust to do it. Of course, I would train him a little bit more, as an assistant with me in the operating room before I actually gave him a scalpel for my back, but he's not far from being ready. I've already done training with him, and he's close. He's very close. That's who I would trust. Now, you may or may not know this, but my brother is also a neurosurgeon. My brother is Armin Duke-Majan. I'm in Melbourne, Florida on the East Coast. He's in Tampa on the West Coast. He's also a good neurosurgeon, but he does not do these types of surgeries. He's doing the fusions and laminectomies and that kind of stuff. So, yeah, I would go to Dr. Patel. Any other questions?
Yeah, we have a few more. This next one comes from Teresa. They asked, can I just send you my last MRI and go from there to see the problem? I had L's fused in a decompression. Easy peasy, no. What that last word was.
Hi, Teresa. We would be happy to figure out where your pain's coming from. I could figure it out in about 2 minutes if I can just see you, have you show me where it is on your back, and I have your MRI handy. But I also need you to fill out the form online, so you cannot just send me your MRI. Folks, for those of you wondering about just send your MRI in, that doesn't work that way. We have a very highly structured, organized, efficient way of doing free MRI reviews, and it requires you to go onto our website, go to our free MRI review page, fill in the data that we're asking you for, send us your MRI by UPS, FedEx, or upload your images from the DICOM file that's on the CD onto our portal, or send us your portal with login credentials. Those are your options. Once we get your MRI, we will schedule you for basically a 10-minute face-to-face with me. You'll see me, meet me, talk to me, and I will tell you exactly where your pain's coming from and exactly what to do to fix it. All right, and if you say to me, well, that's great, but what about fusion? Would that work? I'll tell you, yes, it'll work, or no, it won't. Depends on who does it. So I'll answer all your questions. I'm prepared to do so. I've been doing it for years, and I'm quite good at it, very efficient at it. So I can help you, but you've got to do it our way. You can't just willy-nilly send us your MRI and hope that we'll be able to look at it. We don't do that, okay? The only reason I'm able to do as much as I do on a day-to-day basis is because we do it in a structured, controlled, tried and true, proven manner that's extremely efficient and reliable. So you have to do it our way, or don't do it at all.
Last question comes from Chris on YouTube asking, what's the difference between a DLDR and a conventional microdiscectomy?
Great question, Chris. What's the difference between a Duke laser disc repair and a conventional microdiscectomy? Many, many, many things. Too many to even list. But let's start with the skin incision. Well, let's start with the intent of the surgery. What's the intent of a microdiscectomy? The intent of a microdiscectomy is to remove a herniated disc that's pinching a nerve coming out of the foramen. The reason why you're doing that is to treat leg pain, weakness in the leg, numbness in the leg, or a drop foot. Maybe you've heard of a drop foot. Okay, we call that radiculopathy. It means the nerve root is not working properly because it's getting crushed. So the purpose of a microdiscectomy is to treat leg weakness, numbness, tingling. It is not ever going to fix back pain. The purpose of the Duke laser disc repair is to cure your back pain and your leg symptoms, both. So the microdiscectomy target is the leg symptoms, not the back pain. The Duke laser disc repair does back pain and leg symptoms, so it does everything. That's one difference. Another difference is microdiscectomy, you're going to make a bigger incision, about that big, 21 millimeters, and you're going to peel the muscle off the spine. Peel it off. As you're doing that, as a surgeon, you're killing the muscle. So you're going to create scar tissue where the muscle was. You're losing muscle, you're creating scar tissue. Then you get to the bone. In a microdiscectomy, you got to drill a hole in the spine. You are making a hole in the bone that's holding your spine together. See this bone right here? It's called the facet joint. You're taking half of the facet joint out with a microdiscectomy. You literally drill it out or bite it out with metal instruments. We don't do any of that with the Duke laser disc repair. We're not making any holes in your spine. We're not taking any muscle, ligament, bones. We're not creating bleeding or scar tissue. All right? Then the microdiscectomy does not use a laser to debride the annular tear. The Duke laser disc repair does. Microdiscectomy just pulls out big chunks of herniation. It leaves a lot of herniation still there, which is why the annular tear never heals properly with a microdiscectomy. So you have a non-healed annular tear, high risk of reherniation with microdiscectomy, and you've also destabilized the spine by removing bones and ligaments and taking out half of the facet joint. Microdiscectomy is a shit procedure. Don't do it. It's horrible, bad, evil, but surgeons recommend it to their patients because that's all they know how to do. And the other thing about a microdiscectomy that's good for the surgeon is that once you have one, you're coming back for a fusion because they know they're going to get you on a fusion, right? I mean, I don't even know how to explain it. It's like they're setting you up to have a fusion by doing your microdiscectomy, okay? So they just, by removing the bones and ligaments, creating instability, you're going to come back in 6 months begging, literally begging for a fusion, not knowing any better. And they're going to do it. And they're going to say, he begged me for the fusion, that's why I had to do it. And then, of course, when you have a complication, they're going to say, remember you were begging me for that fusion? You were begging me for that fusion. That's what they do. I know how they work, how their MO is. I've seen it thousands of times in my colleagues. Okay? So don't be a sucker. Don't go for a microdiscectomy. Someday those surgeries won't be done anymore. They're going to be completely removed because they're so damaging to patients. And they don't last. They don't work, they don't last.
Next question comes from Darren. Last question is from YouTube. They ask, what can parents do to help their kids avoid back issues later in life?
What can parents do to help their kids avoid back issues later in life? That's a great question. So here's the thing. What we know for sure is that back problems with discs and facets, it's passed on from parents to kids genetically. There's a genetic predisposition, meaning we inherit from our parents the increased likelihood of having painful discs and needing treatment. It's true. Parents hand it down to their kids. So what could parents do? Well, first of all, the most important thing is just because you've inherited some bad genes doesn't mean you're going to have a problem with your spine. There's one common element to all back pain, and that is trauma, a history of trauma. Every single person that has had back pain from a bad disc or facet has trauma in their history. Now, you may not even remember the trauma. It may be 20 years ago, 30 years ago, 40 years ago, but I guarantee you there was some trauma to your spine. So the genetic predisposition that parents pass on to their kids is just a predisposition that either higher incidence of annular tears or predisposition to having traumatic injuries to the spine, or an inherited predisposition to having symptomatic injuries to the spine. There's a difference. So you can inherit an increased likelihood of having injuries to your ligaments and stuff because you have weaker ligaments, or you can inherit a predisposition to having more inflammation. So I'm not sure which one it is. It's a great question. Nobody's ever studied it, but it's something that will be studied in the future and something that needs to be studied. Do people inherit a predisposition to traumatic injuries, or do people inherit a predisposition to inflammation related to those injuries? And I don't have the answer to that. It's a great question. So what could you do? Have your kids avoid trauma. Avoid car accidents if you can, or especially, I hate to say this, is America, but avoid football. Football and gymnastics are two sports that are very highly associated with chronic back pain later on. Okay? All right, that's it. I hope you enjoyed this broadcast. This patient is going to go home in about 15 minutes from now. His surgery went perfect. He'll go back to California tomorrow. Our next patient is from Indiana, And we're going to do a 1-level lumbar DLDR right approach, followed by the Duke plasma rhizotomy in the thoracic. You'll be able to watch